Yeah, I think there are several misconceptions in the medical circles and in the public's eye about mental illness, and the one largest misperception is that it's probably not treatable or curable. So people are often afraid to go for help because they would think, you know, if I go for help, I'll be seen as either mad because of the stigma, or what would it help anyway because I wouldn't be able to be treated. But I mean, mental illness is very successfully treated, especially major depression, that you can actually cure it. So lots of patients can go off their treatment and be cured. There are other conditions like bipolar and schizophrenia that is not curable but highly and very successfully treated. So I think that's one of the misconceptions. The other one is that, you know, who do you go to go for help? And often general practitioners are not or don't feel equipped to and sufficiently trained to deal with these conditions. And so people always think you must first go to a psychiatrist or a psychologist, which is not necessarily the case. If there are GPs that are well equipped and trained to deal with this problem, and that can be very successfully treated primarily in the primary healthcare sector, where it actually should be, because it's very common.
I think there are still, unfortunately today, a lot of misconceptions. They are less than previously. One of the big issues still today is that people, the public out there, when they become mentally ill, are unsure of where to get help and also what type of help is available, and often also not knowing which professionals they actually need to go and consult. The difficulty is also that within the professional community that it is not always that easily recognized. So one would also see that some conditions are underdiagnosed and therefore also not getting the appropriate treatment that it should get. And stigma, unfortunately, is still playing a role. It's still part of the picture that people just don't go for help. So I think awareness is all round kind of, one should say, maybe the buzzword that one need to make people, whether it's the public or the professionals, aware of mental health, and that it is treatable, it's manageable.